This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Sisters Stacy and Dana never felt so confident when they were chosen as brand ambassadors of a popular clothing line.
Shocked and overwhelmed, like, is this really happening? Yeah. And, we were really grateful and very thankful for the opportunity. And from then, that's where everything started. We got other opportunities to be brand ambassadors of other brands. So yeah. it's a good feeling to know na parang ito na yung fruits of our labor.
But this is far from the kind of self-esteem they had a few years ago.
We were big kids. We're the biggest in the batch. We're
tall,
biggest. Yeah, we're big boned. So we always get teased, and that's where the insecurity came from.
They became obsessed with losing weight. The girls resorted to starving themselves and taking diet pills.
I got hooked with diet pills and calorie counting. There was a time that I would eat half cup of rice the entire day. That's the only thing I would consume.
They became obsessed with losing weight. The girls resorted to starving themselves and taking diet pills.
Well, I became anorexic for a time, and and when I couldn't handle not eating anymore, like when I really was feeling hungry, I'd eat a lot and then I'd purge naman. So I was anorexic bulimic.
Stacy was even hospitalized and was later diagnosed with an eating disorder.
Anorexia nervosa is a disorder wherein there is excessive fear of gaining weight. Yun naman bulimia nervosa, there is loss of control of eating. May compensatory behavior. Kakain siya ng madami. Tapos marami siyang mechanism to get rid of that extra food.
Anorexia and bulimia are the most common eating disorders.
They have multi-organ problems. Minsan sa shutdown ng kidney kasi nga, di ba? They are dehydrated.
Today, Stacy and Dana have moved on from their weight issues and can proudly say they are happy with their bodies. What are the types of eating disorders? What can cause these eating disorders? What treatment should be done for people with eating disorders? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Joseph Sayo, psychiatrist from the Philippine Mental Health Association and Philippine General Hospital. Also joining us tonight is Dr. Ronaldo Elepaño III, psychiatrist from the Medical City. Good evening, doctors. Welcome to the show.
Good evening, Angel. Good evening, Angel.
Tonight, it's all about eating disorders. But before we can proceed with our discussion, we'd like to know the definition of an eating disorder. So, Dr.
Yes, an
Sayo,
eating
would you
disorder
like to
would involve the person's self or body image. It would also involve his eating practices and how he feels about eating. So eating disorders, you have many types. So there's anorexia nervosa, there's bulimia, and there's binge eating. Maybe we can discuss it one by one because they also have differences. So like to differentiate the three.
So you mentioned before we get into that it's a lifestyle. It's how you see food, your relationship with food. So it's not just medical. It has a psychological effect. It has a physical effect, and
it's actually a spectrum, But for simpler terms and for points of discussion,
yes.
It's basically whether there is an excess or a lack of intake of food that makes it a disorder. And then when we go into the types of it, you can actually know which kind of disorder it is.
Okay. Before we go to the disorder, briefly, what are normal eating habits?
Normal eating habits would involve eating three complete meals, and you can also have snacks in between. And you have a healthy body image, so you try to maintain your normal weight. And you don't feel bad about eating a lot of food.
And your relationship with food is that of you're happy when you see the food,
Yes,
you
yes.
enjoy it.
Yes.
Again, like what you mentioned, not in excess.
There's no guilt when you eat food.
there you
know,
go.
that's very
Okay.
important also for eating disorders.
Yes.
And that when you eat, there is no medical complications that will arise from you eating. So when you eat in excess or when you eat less, there's no medical problems that will stem from that lack or excess in eating of foods.
So when doesn't it? When does the norm become disorder,
Yes.
Dr. Sayo?
I think that's when we have to be aware of the symptoms of the eating disorders per se, so we can identify a problem as it arises.
Okay, you mentioned anorexia as being part of an eating disorder and bulimia. Let's now go on into anorexia.
Anorexia,
Signs and
yes.
symptoms of one who is suffering from anorexia.
Yes, in anorexia, so there would be drastic ways, and the patient would want to reduce his caloric intake. And there is a certain intense fear of gaining weight. And then also one of the criteria would be there would be already some physiologic changes because of the induced starvation of the person. So related to what Ron said, the medical side. So it starts as psychological, then it goes to medical complications.
There is a lot of physiologic changes that will occur when you do not take food with anorexia nervosa. For women, it's mostly seen as the lack of the menses. So because they don't eat so much, there's the lack of the production of the menses.
Okay. You mentioned women. Do men also suffer from anorexia? Is it also common? in
Yes,
men?
but it's more prevalent in women.
Why is that?
It's more prevalent in women and also more prevalent in the mid-teens and early 20s age group. So I think to answer your question, it's about some body image issues we have on women, like beautiful is thin, and to keep looking good, you have to be this certain weight.
It's really because also that the adolescent age group are the impressionable youth.
Yes.
Yes.
You see that most of them can be easily influenced by peer pressure and popular culture. And of course, it can also stem from an earlier problem in childhood when there is certain problems in the family. But more commonly, we see this in problems with peer pressure.
Okay.
So in terms of women are more self-conscious.
Yes.
There's a lot of emphasis in popular media on how you should look. And this also translates to men. There are studies now that there is more and more men also who are developing eating disorders. Those who are in the modeling industry, in sports also, there's a certain desire to look a certain way. There are also studies that says that gay men are more at risk for eating disorders because there is more pressure for them to look a certain way. The ripped six-pack abs that everybody wants to achieve. So they
Yes.
tend to actually be predisposed to eating disorders.
And so with the influence of wanting to
Media.
look a certain way or emulating someone who looks a certain way, they forget that we all have different body types. We
Yes.
all respond to eating in a different way. And as you mentioned, in the youth, in their 20s, childhood also, it can stem from that. And
Yeah.
can it also be genetic?
Well, yes, it can also be genetic. So some of the persons with eating disorders, they have a family history of depression or anxiety. And likewise, persons with the disorder, they have comorbid depression and anxiety. So for depression, it would be about 65% of patients with eating disorders would also have depression, and about 35% of them would have anxiety.
So, an eating disorder does lead to
Yes,
depression.
yeah,
and
it can be
coupled with anxiety.
genetic,
It could also be
psychological.
comorbid. They may
Comorbid.
occur together.
Wow.
Yes.
There are studies also that says that there are twins who are, the twin studies will tell you, which is very strongly indicative of a biological background, meaning that it is genetic, you know, that twin studies will tell you that there are patients who can have anorexia nervosa, you know, in a twin study. So for instance, one twin will develop anorexia, the other won't.
Okay.
Yes.
Okay.
Doctors will go back to that. I also want to, I'm sure our viewers are also curious to find out the signs and symptoms that, go with
Yes, the
one who
signs
has
and symptoms.
anorexia. But doctor, we'll
Okay.
go first to our Facebook question.
Okay.
How can I tell if someone has an eating disorder? Oh, we were about to discuss that and it was asked. So,
Well,
doctors?
if we're talking about anorexia, so one sign would be the drastic weight change. So we have an ideal weight. So for example, it's for men, it's about 50 kilos to a 5'4" man, or 45.5 kilos to a 5' female. So if the weight goes drastically low, so about the patient fails to achieve about 85% of the expected weight, so we can call it a drastic weight change. It's significant. And for other eating disorders, so there would be like in binge eating or in bulimia, that the person would hide the binge eating, so and then purge or vomit later on. So these are the signs and symptoms that we see.
You see a lot in terms of bulimia, the tendency to eat at specific periods of time.
What exactly is bulimia, doctor?
Bulimia is actually an eating disorder wherein you have episodes of binge eating and compensatory behavior such as purging or trying to get rid of the intake of food that you have. Most commonly, you see this as trying to, poke their throat so that they would vomit the food that they have taken in. But there are also other forms such as abusing laxatives so that they will just flush it out of their system.
Again, to look a certain way.
Yes.
Yes.
The binge eating is the bulimia is actually related to also a self-image. What differentiates it from anorexia is actually the weight. The anorexic, which is easier to identify, is because they're very thin. They try to restrict food, and they can actually binge. But and purge, binge and purge. For bulimia, on the other hand, they maintain their regular weight despite the purging.
Okay.
So it's a little bit difficult to identify bulimics.
Yes.
On the final end of the spectrum, you have your binge eating disorder, where you actually eat at specific times of the week or the day. You eat excessively, and there's certain emotions that are evoked. You eat even if you're not hungry. You eat excessively to the point that you feel overly full, that you're going to vomit, but you don't vomit.
Okay.
And then you feel guilty afterwards.
Yes.
Okay, and there's guilt that goes into all these types of disorders because
Yes.
again, like going back to what we said earlier, it's your relationship with food.
Yeah.
And these days we hear the word stress a lot. Now we have a question from Facebook related to stress. Is stress eating considered an eating disorder?
Well, I think it would depend on the frequency of the binges. So if you feel stressed, you eat a lot. But if you don't do it more than twice or 3 times a week, so it wouldn't be called a disorder yet.
And one of the key factors when it comes to binge eating or stress eating, for instance, if it becomes a disorder, is there's a tendency to hide it from the public. So commonly in our society, when we get stressed, we try to eat out or pig out, as we would call it, with friends.
You eat with
Yes,
friends.
yes.
Yeah,
With
it's social.
binge eating disorder, it's really a solitary activity. You hide it from people that you eat so much. You eat very fast so that people won't find out that you are binge eating.
So solitary disorder, just like bulimia.
you're
bulimia.
alone when
Yes.
you,
Yes,
like
you
you mentioned
hide
earlier,
it.
you poke your mouth. Anorexia also, you hide it? Or
With-
is it, amongst friends, you can't hide it anymore?
You can't hide it because of the drastic weight change.
People take notice that
Yeah.
you are actually losing weight.
Okay, and then that's when they say, sometimes it also becomes a joke, oy, anorexic ka na, or you
Yes,
look
yes.
anorexic already. But we will go back to that, the eating disorders, treatment, and more on understanding eating disorders when MedTalk returns.
Did you know that award-winning artist Lady Gaga experienced an eating disorder earlier in her life? Lady Gaga revealed to a women's conference in California that she suffered from bulimia. Her purging almost took her voice away, but her love for music prevailed. She overcame this disorder.
We're back here on MedTalk, still talking about eating disorders. Doctors, before the gap, we were already talking about a little bit of the treatment
Yes.
that one must seek, or one that must, how else would you say that, be provided for. We cannot let this conversation go without understanding the role of family members and people who care for individuals who are suffering from an eating disorder like bulimia, anorexia, and excessive eating disorders.
Yes.
So, doctors, how does first one admit to himself, or how does a family member identify this particular eating disorder? Dr.
Well,
Sarah?
regarding with the family, so one of the treatments would be family-based therapy. So we have to really to advise the relatives of the patient to be observant of the eating habits of the person, and to really notice to observe for these symptoms of these eating disorders. And I think for parents, so we have to advise them, because we learned earlier this is due to social learning. So we have to tell parents not to be overly critical about the weight of their child, and we should also tell them to refrain from bullying other children who may be overweight.
Yes.
For those who are actually afflicted with the disorder, the treatment is actually tailored fit to the
Yes.
individual. So the first step is really identifying if there is a problem. So bringing the patient to the doctor
Yes.
will be the first step. And then once the diagnosis is made, a full medical workup is done to see what needs to be addressed. For instance, anorexic patients who are, very low in terms of their weight, it's not as easy as simple as providing them with so much food and that they're going to go back to their normal weight. It has to be a multidisciplinary approach, meaning there should be an endocrinologist, a cardiologist,
Yes.
a nutritionist on board to treat the patient. So there's a treatment team that will address the patient's problem. And then once this has been done, medical status has been stabilized for these patients, outpatient treatment will begin. So there is a lot of success in terms of medical treatment initially when they're hospitalized, but the bigger challenge is the outpatient treatment.
Yes.
So this is where Dr. Sayo has mentioned where you need to engage the family in terms of the treatment.
Because when you're outside already, you have the same influences around
Yes.
you, and you
Yes.
can go back to that habit, you can go back to that disorder. So what happens to an individual? Do they take medications? Are they under therapy?
Yes, we can give medications. So, we mentioned that some of them have comorbid disorders like depression and anxiety. So we can give them antidepressants, and these antidepressants also help, like for bulimia. like it's an impulse control problem, so it helps control their impulses. And then for therapies, we also have to go to individual therapy. So for persons who have problems with their body image, so they have to undergo counseling, and we have to teach them that they have to accept themselves for what they are. So however they weigh.
They outgrow this.
There's a lot, if the patient will actually go into therapy, be religious in their treatment, because not all patients will be the same in terms of treatment. So not everybody will be given medications, not everybody will respond to the same type of therapy. So if they find the right fit, of course, the success rate is high, you know. But of course, the problem is not limited to just the patient, but you need to actually move forward towards not from the individual to the family to society. So that's how you approach the eating disorder problem. That's why most of our patients, we recommend for them to have a support group so that they can talk about these things that they are going through.
We'll talk more about that, doctors. We have a question from Twitter. Can someone recover from an eating disorder without seeking professional help?
I think that would be hard to answer because we really have to have an evaluation by a professional how serious the condition is.
In terms of the statistics for those who don't seek help, the mortality is high. They actually die before they actually recover from the eating disorder.
Without seeking help.
Yeah, if they don't seek help.
Okay.
So this is what we try to, impart for the audience who are listening to this program, that if they suspect a family member or someone they care for to have an eating disorder, it wouldn't hurt for them to be seen by a doctor and evaluated. Because for every, an ounce of prevention is better than a pound of cure.
And it's more hurting for the family member to see this individual who has an eating disorder suffer. You mentioned earlier that in their teens suffer from an eating disorder. In their 20s, they still continue to have these eating disorders. How about the seniors, the more mature individuals? Do they also experience this? Do they also go through this?
Well, yes, there are also some instances where the elderly can have eating disorders, but most of these cases, they are with comorbid depression and anxiety.
For the elderly, the psychological factors that is, at play for eating disorders may not be the same for adolescents. Like when we talk about adolescents, it's mainly peer pressure, how they perceive themselves, it's a body image. For the elderlies, it could be also a means to say something to the family members or a part of a mental condition that they are going through. That's why they don't eat. Some of these people are actually afraid because their memory is failing. They become very paranoid. They don't like to eat. So they become anorexic in the process.
Doctors, another question from Twitter. I am overweight and I feel ugly. What can I do to overcome this feeling?
Okay, this example is, so the problem seems to be psychological. So this person has problems with his body image. I think we have to evaluate him. What does she mean by being, saying that she's ugly?
Yes.
So
In reference to what or to whom? Maybe
in reference to what?
Yes.
Okay, so
There is a form of therapy that we employ for those with eating disorders. It's what we call cognitive behavioral therapy, where we evaluate this thought process, this automatic thoughts, the belief that I am ugly because I'm overweight. Is this true or is it not? Because you can be shapely and still look good.
And you can be thin and still look good and be healthy.
yes.
So these are things that can be worked up in terms of therapy. But for this instance, I suggest that she comes to the clinic and find somebody to actually talk to them about these feelings, because I think that statement is loaded, as we would call it. It speaks a lot of inner inner problems that they're encountering. There's a lot
Self-esteem.
of frustration
Yes.
there. So these are things that we can work out in therapy also.
Okay. And you know, for someone to say that she doesn't like the way she looks, then it is a cry for help. It is a signal for the people around her.
And for them to
take
put it
note
up
of
there,
that. Yes.
that is actually somebody's desire or a plea for help.
And here on the show, we always would like to know more about the topics that we talk about. However, we don't have enough time
Yeah.
anymore. Sorry, that maybe we can have you again.
Okay.
But last words to our viewers, to those who may be suffering from an eating disorder, and for those who have family members who are going through this. Would you like to give them advice?
Any advice? So I think eating should be enjoyable. It should be a social activity. So if you have bad feelings about eating, I think we need to undergo some evaluation or just think about it on why do you feel that way.
It's not just physical, you know, it's also mental.
Yeah, it's psychological.
It's psychological. Yeah, doctor.
Well, I always say that food should be enjoyed by everybody. And if you feel guilty or afraid whenever you eat, you may need to talk to somebody
Why is there
about it.
fear, doctor? Why is there fear when you are faced with food? What is it about food that makes you afraid?
Well, I think there could be other reasons, like some of the patients underwent bullying when they were little. So if they were teased of being overweight, so now they become afraid of gaining weight.
Okay.
And of course, that gaining weight could be tantamount to the kind of value they have for themselves.
Yeah.
If they lose weight, they become more valuable to other people.
Yeah.
So we can help, you know, there is always help available. Family members who are truly concerned about their loved ones should go to their doctors and have their family members who they suspect have an eating disorders checked up.
So thank you very much, doctors, for enlightening us, for helping us understand more about it, and for us to enjoy food. You know, your relationship with food is reflective of who you are and how you
Yes.
see yourself and how you see eating. So it's fun to eat the right amount,
Yes.
the right time,
Yes.
with the right people. Thank you once again, doctors. Again, thank you, Dr. Joseph Sayo and Dr. Ronaldo Elepaño III for joining us in our discussion. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.